And when we started, no one was talking about the health dimensions of the climate crisis, and now everyone is talking about the health dimensions of the climate, because people all around the world, billions of people, are experiencing in their lives, in their families' lives, in their health, those impacts of climate change.
We've been working with Healthcare Without Harm for many years. Many years ago, when climate and health was nowhere where it is today, they were the only ones pushing for this agenda. How healthcare provision needs to decarbonize, how healthcare needs to make the health argument for climate action. Beyond decarbonizing healthcare, which is super important, we need to collaborate to redefine how health systems work, and moving from treating people when they're sick to really focus on prevention, supporting people to adapt to the health impacts of climate change.
The nexus between health and climate was strongly recognized by the parties at COP28. And this recognition would not have been possible without the incredible leadership of allies like Healthcare Without Harm.
The commitment to action doubles the member institutions of Equitable Green and Healthy Hospital Network that will sign up to the Race to Zero campaign. That means that they get to halve their emissions by the year 2030 and become net zero by 2050. That represents thousands. Right now, 14,000 hospitals and health facilities around the world who have committed to this. It also allows us to start looking at how that affects the resilience in the communities that those health facilities serve. And it allows us to actually measure how many of those patients can actually be served in terms of stress.
When we put people and our health at the center of the climate crisis, we find solutions that lead not just to lower emissions or successes measured in the metric tons of carbon avoided, but actually to better health outcomes, to children who are able to have healthier, better futures, and to all of us and our prosperity.
We've been the architects of bringing the healthcare sector to this new mission, this expanded mission around climate and health. And we continue to sort of build the network and the movement inside of healthcare for this larger transformation in society.
It's been an amazing ride in the last 5 years. We've seen the world's governments, national health ministries commit to climate resilient, low carbon healthcare. We've had declarations on climate and health from the World Health Assembly, from the world's health ministries at the COP, at the climate negotiations. We've got health sector organizations, both public sector and private sector, all engaging on this issue.
UNDP is a really proud partner of Healthcare Without Harm. We've worked together in many different projects, including, importantly, decarbonizing supply chains in the health sector, pushing coalitions to talk about and take seriously that climate is a health crisis. Health is and must be at the front lines of the climate crisis response. Healthcare Without Harm has been a pioneer in this space, and the organization has really been leading for decades. It must have been difficult and somewhat lonely, but now that we are here with a much broader coalition, I think it's time for Healthcare Without Harm to lead, to share their experiences, their lessons over the past few decades on how we can do this work together.
We have a lot of things to celebrate with our colleagues and friends from the Healthcare Without Harm. They have been absolutely critical, fundamental on creating this coalition of climate change and health.